The other point to be made is, looking back at this previous picture, is that individuals that have a communicating hydrocephalus may show up differentially on imaging. So, for example, it's important to recognize where a ventricle and why a series of ventricles will be dilated relative to an individual blockage site. For example, if there is a blockage at a foramen of Monroe, only one of the lateral ventricles will be enlarged. If there is a blockage at a level of the cerebral aqueduct, then the imaging will show both lateral ventricles being enlarged as well as the third ventricle, but the fourth ventricle being of normal size. And then finally, the other site where you can develop a non-communicating hydrocephalus might be at a blockage of one or more of the openings that allow exit from the CSF, and then in that case, all of the ventricles will be enlarged as a result. So an image basically can give you an instant clue as to where the cause, particularly of a non-communicating hydrocephalus, is based on which ventricles appear of normal size and which ventricles, one or more, are subject to enlargement. Then, typically, the concentration of CSF typically has a fairly low concentration of protein, and meaning that increased protein levels indicated or detected on a spinal tap might indicate the presence of a CNS tumor. Normal CSF has very few white blood cells, so again, if that number is elevated, that obviously can indicate a pathologic condition. Red blood cells are not normally found in cerebrospinal fluid, but certainly might be present in a bloody spinal tap or might be there as a result of a subarachnoid hemorrhage. Increased protein levels, as we indicated earlier, are a classic indication of a CNS tumor because protein levels are much lower in CSF compared with normal arterial blood. And again, tumor cells may also be present in the CSF in individuals that have a meningeal involvement because of the close association, certainly, of the meninges with the arachnoid space.